Hi, Dr. Bradshaw here with Chirocynergy. We're talking about low back pain today, and in this case, it's a muscle most people don't realize affects their lower back. It's the hip flexor. So most of the time when we think about the low back muscles, we think about the muscles that are located from the ribs down to the tailbone. But in this case, we're going to deal with muscles that are in the front, from the hip sockets up into your low back through the groin. Here's how you're going to do that stretch. You're going to need to get on the floor, okay? And I recommend that you get a pillow for your knee. Make sure that your knee is on the ground, okay? So if the side of your low back we're stretching is the left side, that left knee goes on the ground. Once you're there, place the other foot forward so you can lean into the stretch, all right? Look at this 90-degree bend in your knee. This is where you should end up. So if the leg looks like this, you're not in the right spot. You need to move your foot so you don't irritate your knee tendon by leaning forward, okay? 90 degrees, perfect. Next, make sure the foot is flat behind you. You don't want the ankle popped up like this. You want the foot flat like that, okay? Now, you lunge onto this front foot. You place your hands onto your knee. This is important. You're going to use the leverage of your hands to push your shoulders back this way. You're not going to lean forward in this stretch. You're going to push the shoulders back. Then it's going to take this hip flexor muscle that runs here and stretches up this way. We're going to lengthen that muscle this way. So we're going to push the shoulders back, allow the hips to drop, and then you take deep breaths. As you exhale, try to drop the hips farther towards the ground. Let it relax. As you breathe out, you'll feel a deeper stretch, deep into the groin. You hold that for 5 deep breaths. After 5 deep breaths, you come out of it, switch sides. Right knee on the ground, left foot forward. And again, lunge into it, use your hands, push your shoulder backwards like this. And again, 5 deep breaths, okay? Now, some of you might need to do this more than once a day. Some people, you need to do this once an hour. People who sit a lot, they get tight hip flexors. The hip flexor allows you to flex the hip like this. But if you're all sitting all day long, those hip flexors stay tight. So if you sit on a computer all day long, typing, or you're sitting on a truck or driving a car all day long, those hip flexors stay tight all day long. And I bet if this is you, when you go to stand up after sitting all that time, you've got back pain right in here, because that's where the hip flexors attach. So you got to stretch these out to fix your back. So do this as often as I recommend. For many of you, it's once an hour while you're sitting, okay? Enjoy this, and you'll thank me later when your back's feeling better.